Third part of the program, third and last, I'm going to go through CHROME. CHROME Guided Smile. I think it's really the leading full arch guided system on the market. Lots of doctors agree and say so. Published in many articles, peer-reviewed articles. We have made more than 10,000 of these cases to date all over the world. And it's just a fascinating, predictable system. We have a private Facebook group. Just type CHROME group or Guided Smile, you'll find us. It's private, so we'll have to let you in. But this is where we make all of our announcements, our tips, our tricks, our posts. Encourage anyone who's involved in full arch guided surgery to be on this. CHROME is, it's a pre-planned, I'll just read this, is pre-planned surgery that starts with the smile simulation and ends with an ideal designed full arch prosthetic. CHROME delivers bone reduction guidance, osteotomy guidance, implant control, abutment insertion, a simplified prosthetic conversion, and a very simple method of converting to the final restoration. For all these cases, well, most of the cases start with a smile simulation. Patient has, patient can share a nice smile, and it's an upper, and we can see teeth, and we do a smile sim. And we've made thousands of these, and they're gorgeous. This is the best company in the world that does it. They teach it. You can buy it directly from them. It's like $199 a month, and you can do as many smile sims as you want. It takes your staff about 4 minutes. You just take a mouse and you outline the mouth, and it gives you a proposal. You make some little changes to it, and you show the patient. So you have a patient in hygiene, take a nice photo. Patient comes out to the consult room, and you have this smile waiting for him. You'd think that that smile on the right was the patient's final restoration, but it's just a smile simulation. They love them. And you get more yeses with smile simulations. They're the best. We've used many different systems, and this one by far is far over the top the best. We have a basic catalog. They can just pick, standard ovoid, triangle, rectangle, square. And, are we going to copy this 100% perfectly? No, but we're going to get darn close. And it's going to be masculine or feminine, long, short, that kind of thing. So it'll be darn close. So CHROME records, I won't spend much time on this at all, but the CHROME records are really very simple. Here, just go back up here. Photos, master cast with bite, CT scan. If it's a dentate patient. Dentate is a double arch, dual scan. But if it's a dentate patient, these are all the records. General dentistry records. Even CT scans are general dentistry now. The photos, full face, full smile, retracted left, right, and center, in occlusion. That's the important part with those three on the right, in occlusion, because we use those to verify the bite on the articulator. Master casts with vestibules and a bite registration. We want vestibules because bone reduction and guides often go near the vestibule, so we have to be able to see the eminence of the bone. Right here. And a CT scan, and just of the arch of interest, and always open. If it's dentate, make sure the patient's open, biting on cotton rolls, biting on the stick, the little bite fork in the computer, in the CBCT scanner. Never teeth together unless it's edentulous. But again, I'm not going to go through edentulous. If we need to open the bite more than a couple of millimeters, few millimeters, and we send you what's called the JC try-in. If the patient's missing almost all their teeth, it'll have radiopaque markers for a dual scan. But this is what we use to ensure we have the right bite, or if we have the right opening. So we'll open the bite on the articulator, make a JC try-in, send it to you, and you can see this one is open, right? So we open the bite with the JC and send it. The doctor equilibrates and sends it back. And once it comes back, we re-articulate, scan, and it's go time. That's when we have our records and we are following our 5-day, 10-day rule. So 5 days from all the records being verified, couple days to get to the online meeting, have the meeting. And then after the meeting is finished, after we hang up, then it's green light, and it's 10 days to fabricate the guide and then ship. So 5, 10, and a little bit of buffer in the middle for the meeting. During the meeting, usually 15 minutes, maybe 20, It may be a little bit longer if it's a real complicated case, but we'll go through each implant, go through the setup, go through the bone reduction, make sure the implant's in the right position. We tweak it, and then we launch it. And let's just go through a case real quick. So this is Dr. Orr. She's one of our wonderful CHROME doctors up in the Northeast who's done many CHROME cases. We did a smile for her, smile simulation. Doctor took the rest of the records, right? Left, right, center pictures. Bottom left is conventional impressions. And so we poured them up here, and then a CT scan on the upper with no lower. This is just an upper case, so the patient was open. And then a profile picture. We like profile pictures if there's a class issue, right? Class 1, 2, 3. We like to know where we're starting from. We go through a whole process at this point once we receive the records for analysis of smile, vertical, tooth position, bone reduction, prosthetic thickness needs. And we analyze the case and make sure that we have what we need and that we're on the right path. And once the online meeting is finished, so that's a little bit not in perfect order there, but once we're done with the online meeting, we fabricate CHROME and we ship it to the doctor. And we have terms, right? This is pin guide, fixation base, the metal here with the pins, osteotomy guide, right? Osteotomy. Then we have the carrier guide, which is a plastic here that supports the prosthetic and the rapid appliance. That's essentially what we send. It's a pretty simple package that we send. And then you'll need to have our pins and drills, reusable pins and drills called the fixation kit. You'll need our stellar material for luting, for picking up the prosthetic. And then we have some special gaskets here for plugs and for blocking out. And we make this what's called a SurgiMat. Comes in 2 pieces. The SurgiMat is pinned up on the wall. It's about 12 inches tall by about 30 inches wide. And it's a beautiful at-a-glance review of the case while you're in surgery. You know, so if you're looking at depths, implants, bone, sinus, that kind of thing, you can even verify that your surgical guide is seated right, the fixation base. You can verify the implant position. So it's a very handy tool. The mat part of it goes on the counter, and this is where the staff will organize all the parts and literally put them on the mat. These are temp copings, abutments, implants. Everything is loaded on the mat, so you can, sorry about the name there, cover that up. So you can, when the time comes, just start pulling parts for the surgery. Very handy, very organized, as opposed to a box of parts or a Sharpie on a surgical mat, you know, and kind of laid out. So we're going to go quickly through CHROME. I don't want to spend too much time on it. We have lots and lots of videos and tutorials on our website, on the internet. We really opened the book on this product. We try not to be private about this at all. We probably share too much. If you want to learn CHROME, watch our videos, voiceover, and really just talking about all the details. So the first thing that happens is you seat the pin guide and you make sure that it seats passively. Once it does, it's removed. And then the doctor will lay the flap. On this case, number 5 and number 9 need to come out prior to surgery, just a little bit of malocclusion. And also because maybe a pin needed to go in that site. So you have to take the tooth out to put the pin in. Then the pin guide is reinserted and the doctor will drill through these sites, 1, 2, 3, 4, 5 on this case. So 5 pins drilled transcortically, place the pin, sometimes even use a surgical mallet to place the pins. Once they are in, tapped in, then the fixation base is left behind. And you can just see some rangiers here, but these are little CHROME locks. You unclip the CHROME locks and the pin guide comes off. And everything else remaining above the pin guide is reduced down to the metal. And yes, it always looks like a lot of bone, but when the teeth come out, usually there's a little bit of bone that comes with the teeth. It's usually not nearly as egregious. So extract the teeth and then reduce the bone down to the metal. A little more reduction needed here. This is what I was speaking about before, where The bone burrs are very efficient, but you can see it's like it's snowed bone in the mouth here. So a little bit of work cleaning that up, and you have to get it out of these chrome blocks, these chrome boxes here, so that the stackable components can fit. But those were burrs. Okay, you can see a little BB burr here used to round off the edges. There's a lot of sharp edges when you're reducing this much bone. Next step is to put the carrier guide in and ensure there's enough bone reduction. So the doctor put a little stitch back here to hold the tissue back. And then the carrier guide is seated. And if it's not seating passively, it's either tissue or bone. If it's bone, reduce. If it's tissue, reflect. And once that is finished, then you take the take-home prosthetic and seat it. This is a nice early time to check the bite. The muscles have not been, deprogrammed by being open for a couple of hours. So you can check the bite here. And if it's off a little bit, you can take a bite here because we're going to do an extra oral conversion with our new technology. So you could take a bite. And actually, I just made a couple little videos here.
Okay. Open up for me, my love.
So the prosthetic is in, sitting on the carrier guide, right at the middle of surgery. Going to hold it in place, and then just take a bite. Normal stuff. It was the bite was almost dead on, but it was just a little bit off, and we wanted to do an extra oral conversion and an extra oral equilibration. So that's the simple bite technique. We're gonna cover this. It's this C2F technology, conversion to final, to make small holes. So the next step, the prosthetic comes out, the bite comes out, the carrier guide comes off. And then now it's time to double check. Well, I kind of threw this in here so I could talk a little bit about this floating guide technology. Nobody else in the world has this, unless maybe they're trying to mimic, but the metal never touches bone. That's how it can be delivered by the teeth, because every other guide in the world touches bone, and therefore you're getting into undercut. So, and you're also getting onto bone that's not rendered very well, as we talked about before. So our guide is completely held by pin trajectory, right? So in this case, there were 5 pins, and it's all held on trajectory. The metal's floating. And so on the wall, you could look at your surgery mat and say, you know what? Yes, this looks exactly the way it's supposed to, and then move on. We have little nubs here on our osteotomy guide that indicate rotation for indexing implants. You can see them here, because indexing is critical on angled implants. Have to get the timing right, otherwise the temp copings aren't going in the holes. So now we go to site preparing. This is a keyless drill from Megagen. So you drill, we're at the very end of it now. The gold drills are the large ones, but essentially go through the whole process of drilling the sites and then placing the implants through the guide. So this is a fully guided kit. So this barrel here will fit inside of our guide, and you'll deliver the implant all the way until you get to this line. And then with their system, you hand torque the remaining part to depth and rotation with a hand piece. So everybody has a little different system. But you can see how nice it is to watch the implant be guided through the sleeve. And then this would come off, and then you can see there's still some threads exposed. That's normal. And then at this point, you put the guide back on and then tighten down each implant to index. And then one more. This case actually had a little extra guide. I left the slide in here. I thought it was interesting. Because this implant is close to the one next to it and close to this one trajectory wise, we made an extra guide just to drill out that site. Okay, implants are cranked in by hand until they're at the right depth, right trajectory. And then the next step is to put the multi-unit abutments on. Okay, on the straight ones, you can just go ahead and put them in. On the angled ones, like I said, this is angled, this is angled, this is angled. So we have this indicator on this carrier guide, this little notcher that shows where the abutment screw goes, right? And where there's no notch, they're straight. So this is angled thing. A lot of angles on this case. Actually, they're all angled. So it's very important that that notch matches up with the abutment screw, with the abutment driver, and that way you know you're in the right rotation. So the next step is to put some temp copings on, right? And then you block out the temp copings with our gaskets that we provide with every case. And then you'll put these gaskets, the gaskets are on over there, sorry. And then you'll backfill to attach the prosthetic to the copings. So you just use, we provide stellar material, we charge for it, but we provide stellar, and it's a dual cure. So you'll just express the tip down inside here until every coping is connected, hit it with a light for about 20 seconds, and then always want to wait a little bit longer, wait a couple of minutes till it's set. And then you unscrew the prosthetic and remove it. Now, at this point, you've indexed this prosthetic to all the implants. All right, so that's what a simple way to pick up a prosthetic. And now with our technique, what we do at this point, the patient will have the metal be removed, the pins, the fixation base, everything. The doctor will put some comfort caps, healing caps on, suture. All right, so there's no second pickup with this C2F technique. So while the patient is being sutured and waiting, we go back into the laboratory. We take the rapid appliance. We take it back in the lab with the prosthetic, and this one has holes, but I'm going to show you how the prosthetic does not have holes yet when we ship it. The C2F we call it a small hole technology, and allows you to deliver stronger prosthetics with preserved occlusion, longer lasting temps, an extra oral conversion, and a master model that's made on the day of surgery. Really, surgery time should be shorter, more comfort for the patient without two different pickups, and most importantly, occlusion and stronger prosthetics are the result of C2F. It's compatible with these systems. All these systems are no-bell conical connection at the MUA level, so we can do this C2F process. So if your system is no-bell compatible, we can do it. These are the tools. Oh, won't spend too much time on this, but essentially this is a C2F kit. These are special analogs or hollow analogs where we take an MUA replica head and we assemble it with the C2F analog, and it allows us to leave the analog eluted inside the model, and the head can be removed so that we can drill through the prosthetic. You have to have a small hex tool, a drill that we provide, and you just drill through the prosthetic. Let me go through the process real quick. These are special gold screws that you would use back in the laboratory, never in the mouth. Everything in the mouth is OEM with our system. There's no third party that the patient's wearing home. Everything that's third party is back in the laboratory for the conversion. That's really important to know for the rep, for the implant companies, for the doctor, no third party. And here's our goal, left to right, right? This is the normal full arch prosthetic. This is what they look like. So we want to improve upon this by sending patients home with small holes. So I'll go through the process real quick. So the prosthetic came out of the mouth, the rapid appliance. We screw the C2F MUAs in each site. We stick this prosthetic with the MUAs into the model. We lute the analogs to the model. And then once that's finished, we take the prosthetic off, and then we remove the heads of the MUAs. Now they're hollow. See that? And then we drill through the prosthetic. You literally take the drill, hold the prosthetic down, and drill through. And so this prosthetic, when we fabricate it, when we ship it, has no holes. There's the little hole. It's about a 2.8 millimeter hole. And all that time we spent making the occlusion perfect, it wasn't decimated by 7 or 8 millimeter holes and a bunch of acrylic and titanium cylinders and a bunch of lab work. There is no occlusal work whatsoever. You just seed it. No, it's really a brilliant system, and it's a game changer. It's us part of our changing the whole industry. So once you have drilled the holes, then you come back to the model and you put temp copings on it. So this is just like you would put copings in the mouth, except you're putting them on the model. and you just adjust them one at a time until the prosthetic fully seats. And then you block out the holes, you inject from the lingual. This is what it looks like right after injection from these lingual ports. And then you just backfill the holes, backfill these two little holes here that the pegs were on the carrier guide, and finish it. That's it, it's finished. Unscrew it from the model and deliver it. Right, so that's about 5 minutes after we finished it back in the laboratory. Perfect occlusion and a really nice smile. If you're involved in full arch guided, especially if you're involved in CHROME, order C2F on your next case. You will be thrilled by having these small holes and strong prosthetics. You know, one of the worst things that happens with these cases is the prosthetic breaks, you know, right here, right at the distal most, and it separates because there's all this material. That's where it separates from the new material and the printed material that we make here in the laboratory. And is it catastrophic? Yeah, sometimes it can be catastrophic. Patient can lose an implant when you have a part of a restoration hanging off the implant and they don't come in. So these prosthetics are stronger, longer lasting, and much better occlusion. So that's C2F, and that's CHROME GuidedSMILE, and this is the program today. I have my email here, extension. Please, any questions you have, you're welcome to call. You have a situation, you have a guided kit, you want to get involved in this, whatever it is, call or email. Would love to hear from you. Thank you so much for joining us today.